All right, so today we're doing a deep dive on something that I think most people have heard of but maybe don't know a lot about, and that's RSV. And especially now with winter in full swing, it's that time of year to sort of brush up on this topic. We've got some research and news articles here. And the thing that really surprised me was that RSV can actually be even more contagious than the flu or COVID.
Yeah, that's right. And the interesting thing is that for a lot of people, RSV just feels like, a regular cold. But the catch is that it can actually be really serious for certain groups of people.
Okay, so let's talk about that then. Who are the people that should be extra careful about RSV?
It's basically the youngest and the oldest amongst us, so infants and young children, as well as older adults. And, of course, anyone with a weakened immune system, regardless of their age, is also going to be at higher risk.
Okay, so why is that? Why are those particular groups more vulnerable to RSV?
Well, think about it with babies. Their airways are already so tiny, and then RSV comes along and it inflames those airways even more. And it makes it really hard for them to breathe because it fills them up with mucus. And their immune systems are also still developing, so they have a harder time fighting it off. Now, for older adults, their immune systems might not be as strong as they used to be. And they also may have other health conditions that make them more susceptible. And then, of course, anyone with a weakened immune system, for any reason, is going to be at a disadvantage when it comes to fighting off RSV.
That makes a lot of sense. It's interesting. So, it's important for people to not just be aware of their own risks, but also be aware of, who they're interacting with and who they might be putting at risk as well. Now, the virus itself has this weird name, right? Syncytial. What's the deal with that?
So the name actually describes what the virus does to the cells in your body. Basically, it causes the cells to kind of fuse together, and they form these giant cells with multiple nuclei. And those are called syncytia. So it's not something that most viruses do. It's kind of freaky when you think about it, like cells merging together like that. So we know that it spreads through the usual ways, droplets in the air, touching contaminated surfaces and direct contact.
Yeah, and that sneaky aspect of it is made even worse by the fact that it has an incubation period. So that's the time between when you're first exposed to the virus and when you actually start showing symptoms.
Yeah.
And with RSV, that can be anywhere from 2 to 8 days. So you can be contagious for almost a week before you even realize you're sick.
Oh, wow, that's a good point. So, it really does spread easily when you think about it like that. So is RSV just a winter thing, or?
So in Canada, we typically see it from October to May,
Mm-hmm.
And it usually peaks in the middle of winter, so between December and March. So yeah, basically right now is prime time for RSV.
Okay, so this is all very relevant information right now. Let's talk about the more serious side of RSV then, because it's not just a sniffle, right? It can actually be a lot more serious than that. Right. So in severe cases, RSV can actually lead to things like bronchiolitis or pneumonia. So don't let the medical terms scare you. Bronchiolitis is basically when the small airways in the lungs become inflamed, and it makes it really hard to breathe, especially for young children. And then pneumonia is an infection of the lungs, and that can happen to anyone regardless of age.
Yeah. And one of the symptoms I know that's really scary, especially in kids, is the difficulty breathing.
Yeah, absolutely. And it's especially dangerous for children who already have existing heart conditions, or people with chronic lung diseases like COPD because their breathing is already compromised. And RSV can make those problems a lot worse. And although we often talk about how dangerous it is for babies, older adults actually have a higher risk of dying from RSV.
That's scary. So we've been talking about the respiratory system.
Yeah.
But are there any other parts of the body that RSV can affect? Are there any knock-on effects?
Yeah, that's a great question. So your body is a complex system and everything is connected. So when RSV attacks your lungs, it can put a lot of strain on your heart, and it can worsen existing heart conditions and potentially even lead to things like heart failure, irregular heart rhythms, which are called arrhythmias, or even heart attacks.
So it's like a domino effect. One thing can lead to another.
Yeah.
And that's especially concerning for the older adults that we were just talking about.
Exactly. And it's not just the heart. RSV can also make other chronic respiratory conditions worse, like asthma and COPD.
Oh, wow.
So it's not just a one-time illness. It can have lasting effects on your health.
Okay, that's a lot to take in. So let's say somebody thinks that they might have RSV. How do they get diagnosed? Is there a test?
There are 2 main tests. So one is called a NADAT, which stands for Nucleic Acid Amplification Test. And it's very accurate, but it might take a little bit longer to get the results back. The other option is an antigen test, which is faster, but it's not quite as sensitive. So there's a chance it could miss an RSV infection.
Okay, so it sounds like, especially if you're in one of those higher risk groups that we were talking about, it's really important to talk to your doctor if you think you might have RSV and get the proper testing done.
Exactly. Early diagnosis can really make a difference in managing the illness and preventing complications.
So is there a cure for RSV? Is there anything that'll just make it go away quickly?
Unfortunately, not yet. There aren't any antiviral drugs that specifically target RSV. So treatment right now is really all about managing the symptoms and supporting your body as it fights off the virus.
Okay, so what does that look like? What kind of supportive care are we talking about here?
Well, the basics are really important. Staying hydrated, using fever reducers to manage your temperature and keeping those nasal passages clear. Simple things like saline spray or a nasal aspirator can make a big difference, especially for little kids. And if breathing becomes difficult, oxygen therapy might be necessary. And in really severe cases, hospitalization might even be necessary so that the patient can get more intensive care and monitoring. Sometimes antibiotics are prescribed, but it's important to remember that those are only used if there's a secondary bacterial infection. They don't actually work on the virus itself.
Right. They only work on bacteria, not viruses. So we've talked about how contagious it is and the complications that it can cause and the fact that there's no specific treatment. But there's got to be some good news here. What about prevention?
Yeah, well, the good news is that we actually do have vaccines to protect against RSV now. Health Canada has approved 2 vaccines, AREXVY and ABRI-SVO. So this is really a huge step forward in preventing serious RSV illness, especially for those who are most at risk.
That's amazing. That's got to be a game changer for, you know, families with babies and older adults.
Yeah.
So who should get vaccinated?
So Health Canada strongly recommends the vaccine for adults aged 75 and older, especially those with underlying health conditions like heart disease, lung conditions, diabetes, or weakened immune system. Vaccination is also strongly recommended for adults 60 and older who live in long-term care facilities. For adults between 60 and 74, vaccination is optional, and it should be based on a conversation with their doctor about their individual health risks.
Okay, that makes sense. So how many doses do you need and when should people get vaccinated? Can you get it at the same time as other vaccines?
So both vaccines are just a single dose, which is really convenient. And ideally, people should get vaccinated before RSV season starts, which we said is usually around October here in Canada. You can actually get the RSV vaccine alongside other vaccines, but there should be at least a 6-week gap between the RSV vaccine and any other non-seasonal vaccine, just to give your immune system time to respond properly to each one.
Yeah, makes sense. Give your body a little break between vaccines. So we've talked a lot about the individual risks of RSV, but I'm also curious about the kind of bigger picture. Does RSV have an economic impact as well?
Yeah, absolutely. So it's not just an individual health concern. It has ripple effects throughout society. When you have a highly contagious virus that can lead to hospitalizations, especially in vulnerable populations, healthcare costs obviously go up. All those hospital stays, doctor visits, treatments, they really add up.
And I imagine there's a hidden cost too, right? On families and caregivers.
Yeah, exactly. When a child gets sick with RSV, parents often have to miss work to care for them. Sometimes they even have to make really difficult choices between, their job and their child's health.
Yeah, it's a tough spot to be in for sure. So what can we do to kind of lessen that economic burden of RSV? Is vaccination the answer?
Vaccination is definitely a huge part of the solution. By preventing those severe cases, we can really cut down on hospitalizations and therefore the overall healthcare costs associated with RSV.
It's like investing in preventative health care, not just for individuals, but for society as a whole.
Yeah, exactly.